Hey everybody, Matt, Dyan, welcome back to the channel. Okay, Aussie.
I can see that.
Yes, you can. Absolutely. Have one of those. How are you going and what's happening? It's 9 o'clock.
No, really?
Yes, 9 p.m. Monday the 28th. This will be our third video already today, and we're not having a good day. Not a good day. Dyan's already had multiple seizure sets, dystonia, syncope, heart rates that have been dropping really, really low, oxygen that's been dropping out, haven't caught a break. Okay, what do you need help with? Do you want to take it down? What would you like me to do?
I don't know. I really
You don't look good, you don't feel good. I've just put the pulse oximeter on so that we can monitor what's going on. Obviously we've got the graph stuff up and running.
I ate 3 days a day. I'm not supposed to eat meals.
You're not meant to eat food. Gastroparesis really does that. If you're new to the channel, welcome. Dyan does have gastroparesis. It's on the basis on the back of having stand loss. It's a connective tissue disorder. It affects the way her whole GI tract operates. And because she's got a chromosomal genetic disorder, 22q11.2 deletion syndrome, the causation, the umbrella term, of over 185 different clinical symptoms, this is one of them. The bowels aren't moving, dysmotility, impaction, let alone compaction. Would you like some Enos?
It's my tummy.
Enos.
I've just eaten it in my tummy. It's stuck.
It's stuck.
It's stuck. It's coming up and down.
So you've got reflux, the GERD side of things.
It's wanting to come up.
Okay, I'm sorry. I really am.
It won't digest.
Nothing's moving. Things go up and down both ends, and it ain't good. Okay, and I'm concerned because being in such discomfort, being in such pain, is also a key contributor into seizures for Dyan as well, which is why we're monitoring. I've got the data on, I've got the alarms on. Oxygen stats currently at 93.
Sir.
Heart rate is 70.
It's mine.
Are you talking to young William?
Max.
Maximus.
You took my slipper.
Max the cat and Willow the other Ragdoll are both playing at the moment. They don't seem to be relating to the fact that Dyan's in a lot of pain and discomfort. Is there anything I can get you to help you? You've had some on Danzatron already?
No.
I don't think it's
This
working.
is so intense. This is why I don't get to eat a meal.
This is why you
like
don't do the
others.
food thing. But you've had such a crap day and lots of
I haven't
days.
eaten for days.
Her
probably.
nutrition level has really dropped off. And this is the problem when you've got multiple simultaneous things going on, compounding the stress. Now Google, now you want to turn the lights off?
Yeah, on.
Hey Google, turn my lamp on. We've got Google Home Automation in the house. There is a sleep hygiene routine. That's broken already. Dyan had 4 hours sleep last night. She didn't get to sleep until 2 a.m. Up at 6 a.m. this morning. Not enough quality sleep. That's one of the key drivers and the triggers for the seizures that she's been going through. Her electrolytes are all over the shop as well.
Sometimes I eat a meal.
Yeah.
I used to get away with it, but it's just getting worse. I can't.
I don't think so either, boo.
I don't feel good at all.
No, I'm so
It's
sorry.
gonna show my blood test too.
Oh yeah, your blood test is tomorrow. Tomorrow at bright and early, 8:30. I start the online Teams meeting with the hospital in the pain management. We've got 2 days of me attending for Dyan, who can't obviously sit up and attend a group consult on how to manage your pain with psychologists and physiotherapists and all the other
It's not
people.
good timing. I don't have staff.
Well, you don't have 5 hours to sit up straight through a engaging conference. I don't understand their planning. I don't understand why the people who are most in pain, the people who are most disabled, who tend to go to systems and clinics like pain management, are then expected to try and perform. Oh, Baba.
I just don't get to enjoy food.
No, you don't. Your stomach acids aren't going to be working very well. You're getting dystonia? Okay. sudden onset cramp, left. So Dyan was having a lot of left focal dystonic postures. So it's a focalized dystonia in a set location. When it's in the hand, it's also known as writer's dystonia or music. Oops, we've got Syncope. Come back here, darling. Come on. I can't pull your shoulder. Your whole shoulder will dislocate. Here we go. Up we come. Okay, that's okay. Let's not do that, eh? I can't pull Dyan by her right glenohumeral joint. Her shoulder will just pop right out. Because of the hypermobility, she will sublux and have dislocation. And we don't need to be going to hospital to do that today. Syncope, passing out, which is what we just saw Dyan do, obviously becomes a risk, which is why she can fall over, clunk things, fall out of bed. It becomes a falls risk. That's why this device, which we have as well, her Medifone alert, which when she goes out, has also got a falls monitor. So if I sudden do a drop on things like this, it'll actually trigger and alert things as we go along as well. So that gives us a monitoring device to help us when she is falling and about to go into it. Hello, hello, come on. Sweetie, come on. Slow your breathing down with me. Come on. Big deep breaths, not shallow breaths. You're not getting enough good oxygen in at the moment. Sweetie. Okay, let's sitting up there. He's not going to work. We're going to go down.
No.
Yeah, well, I can't have you fallen over and hurting yourself. I'm so sorry. Oh, Bubby, you're going in and out. Okay, where are we at on oxygen? Oxygen at the moment's at 96, great. Heart rate's at 62. Sweetie, you're going in and out. Try and slow your breathing down. Try and take some nice deep breaths. That's it, really good. Absolutely you can. These are only 4 milligrams sublingual on danzatron. So they are a wafer that will go underneath the tongue. Coming in. Okay, just relax on that. Just let it dissolve under the tongue. Oh. It sucks being sick. And sick is really sucky.
No, I can't.
No, I do. I care about what you're going through. So, now, did you know there's also, I'm just going to press here, there's a little pressure point, which will also help some of your nausea, hopefully. Okay. I know it's only a small thing. Okay. If you need to throw up to clear the upper chamber, that's okay. I'd rather you clear rather than having to try and go into a seizure and having food particles blocking airways, okay? So if you need to throw up, it's okay. We've got plenty of sick bags here. Sorry guys, you don't need to watch this, but I'm just hoping that it's going to settle down.
I'm going to keep the calories in.
I can do something else, but for the moment it doesn't feel very good when you've got GERD and reflux, and all it's doing is coming right back up into your mouth. Oxygen stats are good at the moment, 97, heart rate's at 60 and dropping though. Let's just get the pressure. Hello, stay with me. Current time's 9:09 PM. Getting a lot of syncope at the moment. You haven't even had your melatonin. We're actually behind an hour in our night's routine. Hello, stay with. That's a go. We haven't had melatonin yet. You haven't even had your evening sleep medications yet. We're out of whack because of the multiple seizures that Dyan's dealing with. So this is not tired, I'm falling asleep. This is her body doing weird things. Oxygen stats are flapping low at the moment, 93. Heart rate's a little bit higher. She's sitting up off a static intolerance, so I'd expect that. Oh, sweetie. Let me get you a cool flannel. A little bit warm. Okay, need to take you to a picture. Stay with me, you're about to fall back over. We don't want that. Come on. Music's toxic, eh?
I feel poisoned.
You feel toxically poisoned.
Yeah.
Okay, so temperature's not bad. It's only 36.7, so I'm not worried about that for the moment. Stay with me. Once your body's reacting and responding to food in that way. Room temperature is 25.3, so we're happy there. Outside temperature is 14 degrees. Can you lie down, sweet pea?
No.
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 This is the real section I don't like because she wants to sit up because of the nausea, but she's flapping all over in a falls risk. It's increasing the blood pressure. Please don't, Bubba. Heart rate spiking up a little bit high in the 70s. Oxygen's okay at 95. Okay. Stay with. And she's going. Can you stay up for me? Your dystonia in the eyes is telling me that you're not trying. Okay, so you're seeing the eyes at the moment. You've got the right eye mostly closed, left eye open. So Dyan's getting some dystonia in the face whilst she's also trying to deal with the complexities of having nausea, reflux and GERD. Okay, we don't want to have this on the video, so I'm just going to pause this section for the moment. Stay sitting up, thank you. We don't need you falling over. Thank you muchly. Slowly breathing down your hyperventilate. Slowly breathing down with me. Oxygen stats are good at the moment, but slow it down.
I'm dizzy.
I'm not surprised you were just hyperventilating. It's okay. Take some deep breaths in with me. Come on, you can do it. Open up the airway. Come on. Not good. Not what we want tonight. Did I tell you that we've got no supports at the moment? We've run out of funding for Dyan's NDIS. That Dyan's expected to be able to manage without any support when critical. Her OT, occupational therapist, and the other supports, the clinical nursing staff, have directed that she needs 24 hours a day, 7 days a week, full-time supports by appropriately trained nursing staff to be able to manage the complexities of Dyan's health. How many do we have at the moment? 0. So we're going to massive oxygen drop, 90 now. Come on. What's going on, Bubba? Just quarter. Yeah, you stomach bugger. I'll pick him. I'll pick him. It's alright. It's alright. It's okay. Oxygen stats are good at 94. Would like them better. Should be better with. Hey, stay with me. Come on. Come on. Come on. Right, I need you lying down. Okay? I can't play this game. I can't maintain your stability, then you're risking hurting yourself. So. Oh, bye-bye. Oh, not fun. So this is the punishment of trying to eat regular person's food, right? This is the consequence when you break your diet of gastroparesis, yeah? She just can't do it. Gastroparesis really should be forced to be eating about 6 to 8 small meals a day. Very tightly controlled diet. Dyan's lost the ability through the exhaustion, sheer frustration, the lack of calories coming in. She feels damn hungry, naturally. She's had enough. She's also had enough of not being able to have the support staff to be able to prepare her their meals appropriately throughout the course of the day. She knows that I've been distracted, pulled away, having to deal with the health department, the NDIS minister, the support coordinator, all these different balls that we're juggling at the same time in the air. I just cannot fathom how stupid the situation is. There are so many people with disabilities and complex conditions who go through the same sort of thing, and you have these systems behind bureaucracy, red tape, paperwork. Hey Bubba, stay with me. Stay with me. You're about to fall over. Try and stay with me. Do you want to lie down?
No.
Hey? What do you need? You're sitting very far back at the moment. If you tilt it up, you're going to fall forward. I know, huh? Let's get her repositioned. This is from breaking diet. This is from having no choices. This is from giving up and trying to be a little bit normal, because hey, the system expects you to be normal. They expect you just to, you know, cope when you don't have the support staff 24/7 around the clock to prepare very specialised meals that Dyan actually needs, to assist her with not only just the preparation or the shopping, but to also the deliver presentation, to ensure she's safe while she's eating, so she doesn't aspirate and choke him, and to do the clean. This is put upon her and put upon us to actually try and manage and deal with this in between while we're dealing with cardiac, respiratory, multiple seizures. What do you need, beautiful? What do you need? What can I get you? Do you want some Enos? Do you want to try that? Okay. Gotcha. You're doing okay. So the oxygen concentrator is on just to give her some consistent supplemental oxygen at the moment. Her oxygen stats have been dropping as low as 84% and in the 80s consistently throughout today. Nothing wrong with her, right? Nothing wrong with her? We need more support, whether it's from cardiology, respiratory. Hello, we've got Syncope passing out. Current time 9:21. This is putting strain on Dyan's neck, so her CCI, cervical cranial instability, ain't going to be happening with all this. Hello, come back to me, good girl. Hello. You keep passing in and out, okay? So you got Syncope. Do you want to try and lie on your tummy with your knees up on your side to relieve the stomach? Yeah? Okay, so what we're going to do is we're going to lower this down. I've got this. I've got it, it's okay. I've got it in a safe bag, I've got it. Right, what we're going to try and do is lie you down on your side. On your side with your knees up. It's okay. It's okay. What do you need? So busy week still ahead. Tomorrow, 5 hours I think it is with pain management. I know. So I'm going to have the headsets on whilst participating in the pain management conference, while supporting you, managing seizures, cardiac, oxygen, food and whatever else at the same time. Can't get down to the post office. I've got 2 parcels waiting at the post office because I couldn't deliver it to the door, so that puts the extra onus. Knees up, once again, knees up. That's it, take the relieving off the tummy. Good girl. So yeah, I've got to get down to the post office tomorrow. If I get a chance, probably won't be able to do it until the next day, because the Australia Post won't deliver to the door. They've got issues with delivering to the door, as in they can't use the intercom system. This is the 8th parcel in a row that they haven't been able to deliver, and that encumbrance means I have to leave Dyan to go to the local post office. Yeah, sure, it's 2-3 kilometres down the road, but I have to step away, leave her, and you don't know when these things are going to happen at the moment. So stupid. Pathology is meant to be coming in the afternoon to take blood tests to check out the viral load, because there's multiple viral infections going on simultaneously at the moment. It's okay, Bumba. You're doing so well. You're trying so hard. I'm sorry you're in pain. You can see Dyan's got, because of the shingles, well, I've taped it up. I've put some cream, which is some Bactobans, it's an antibacterial, and obviously put some protection of second skin over the top of that. Shingles, which is a reactivation of chickenpox, obviously in adults. Obviously with a low compromised immune system, Dyan's highly susceptible to that. She'll most likely have reactivated EBV, CMV, cytomegalovirus, Epstein-Barr virus as well, and many others that are still resident in her system. We know already that she's neutropenic and highly susceptible to this. Good girl. So lying on your side with your knees up relieves the pressure on your stomach, and then at least you're not falling over, which means you're not at falls risk and bumping or falling out of bed. So it's good to be able to do that. If you go into syncope and pass out, then at least she's safe and being able to maintain, plus we can still maintain airway as we go through this. So keeping an eye on things, oxygen stats are a little bit lower than I like them to be, 94%, 93%, and she is on supplemental. Let's just check the quality of the feed. There's no alerts on the device. The device is attached, there's no impingements. If there was any impingements to the line, it will alarm me here. But she is getting only 94% oxygen sats at the moment. She should be getting 97, 98% at the very least under supplemental oxygen, so the levels might not be enough. Pulse is still a little bit all over the place. She's been doing a lot of flapping beforehand when she was sitting up. It should stabilise now that she's lying down, but it will drop with orthostatic intolerance. Will we have more seizures tonight? Possibly. I'm not ruling that out. She's had obviously midazolam as an emergency medication prior. She's had clonazepam 2 milligrams, her normal night medications to bring the sodium valproate levels up. But she's still very likely going to have seizures, so we'll keep an eye on that. That's why we've got the dystonia going on in the face. They're beautiful. I'm hoping the anti-nausea is helping you. Yeah?
I think so.
Good. You can have some medicinal CBD if you like, because that'll help with pain, but also helps with some nausea if you want to do that. No, that's okay.
Afford it.
I'm not worried about that.
I am.
Okay, I know. Look, we can't afford the medications that Dyan needs at the level of what she's meant to be taking. In Australia, you've got the PBS system, the Pharmaceutical Benefit Scheme. Many of Dyan's medications are not on the PBS. Medicinal CBD, THC, the compounded melatonin, for example. Some of the other seizure medications aren't on the PBS system, so you're paying full price. So you're paying hundreds and hundreds and hundreds of dollars. So on a pension, and Dyan's only on the disability pension, I'm on the carer's pension because I've given up a full-time career and job 8 years ago now, I guess, to become Dyan's full-time primary carer while she's having multiple seizures. She's had thousands of seizures now, but we don't get the support because of a rare genetic condition, as many patients with rare conditions don't get the support in the health system, unfortunately. Oxygen stats are stabilised a bit better, up to 97%, so I'm happy with that. Heart rate's still 67. The dystonia that Dyan gets could also be exacerbating the nausea, particularly if it's not just at the back, it's in the stomach region. You're doing so well, baby.
I can't digest it.
No, I get it. I understand. This is punishment for just trying to be normal and eat a normal food, to try and do something quickly, to try and have that taste, to try and just get something into you, to fill that belly when you haven't had the opportunity, and we haven't had the opportunity. We've been bogged down in the stress of other people, organisations and systems that are completely and utterly broken. Can't believe we're doing the third video today effectively around the same topic, but again with different symptoms and different things going on. Dyan's got some more syncope happening, we've got different blepharism going on. I'm really hoping that we don't go into more tonic-clonic seizures. But look, she's had days where she's had multiple sets of status epilepticus, up to 18 seizure sets in a course of the day is probably her worst case scenario. And when things become out of balance, this is what the body is tipping over. So I'm trying to stabilise, I'm trying to calm, I'm trying to bring the nausea down, the pain down. Pain's been very high. She needs to get sleep is what she needs to do, but then that means I need to give her extra medications to help you sleep. If you take some melatonin, that'll help your stomach a little bit as well. You got to tell me when you're able to, okay? Deal? The other thing I can give you, as soon as you're able to swallow, is Phenergan. Phenergan is part of Dyan's night routine. Phenergan will also help as an anti-nauseatic, okay? So it will help your stomach settle. Do you want to try and take that for me? Okay. Only tablet I'm giving you. That's the one tablet. I'm not going to give you your other tablet for the moment. I'm just giving you that. Good girl for sitting up. So Phenergan 25 milligrams is an antihistamine, but it will help with the nausea as well. That's part of this approach to it all. But just even the thought of trying to take a medication on those sucks, right? Take the action, pop it in, don't think about it. Don't think about it, just do it. Pop it in, swallow it straight down, a little sip, don't overtake the medication. That's it. Little sip, just a little sip, just enough. Don't have too much fluid in there. Dyan's tilting her head to the side because of dysphagia. Good girl, it's okay. Now try and do some breathing. Slow your breathing down. Slow your breathing down. That's it. Slow your breathing. It's okay. You're doing really well. Oxygen stats are 97. Heart rate's accelerated, of course, 82 because she's sitting up. Okay, good girl. Slow everything down for me. That's really good. That's really good. It's going to help. I've got to stay close because you don't know, is Dyan going to pull out the cord or get it wrapped around her? Is she going to tip over? Is she going to go into syncope with her knees up in that position and cause her hips to dislocate or her knee patella to dislocate? Any number of things can actually happen. So you've got to actually be very alert as the carer and as the support, and you've got to be available. You can't just, oh, let's just walk away and get a drink or go to the toilet yourself. You've got to actually be on cue, ready and waiting just in case. Okay? Current time is 9:31. It is Monday the 28th. Oxygen stats are 97. Heart rate is now 67. You've done so well. Okay, I'm hoping it's going to start to settle down for you. I know, it's not easy. It's okay. I know, you shouldn't have eaten food. I said at the time it's a choice you made. I'm so sorry. I'm sure there's many people at home who've got gastroparesis that can relate to this. Dyan's going through a lot of blepharism at the moment in the face. You might not be able to see this directly, but with the eyes, eyebrows. If you're able to lie down, that's going to be your safest positions. Okay, I know you're not quite with it, so let's go with me and lie down. Here we go. Good girl. And we're down. Touchdown, so to speak. Knees up. That's it. Kick the knees up. You're good. Please don't sit up. If you need it. Oh, I'm sorry guys, it's not much fun seeing a person who is sick, and it's not much fun being the person who is sick throughout all of this. It's exhausting. We've both been up since 6. We both would like to be asleep right now.
Give me a good day, God, please.
We want a good day?
Please give me a good day.
Please give me a good day is what Dyan's saying. I agree with that. Let's hope tomorrow is a good day. That's what I'm hoping for as well. It's going to be a busy day, but I'm hoping it's going to be a good day. And it's going to be a challenge. Like I said, if I'm having to attend 5.5 hours of this online
I hate you, hospital.
pain management clinic, and this is just a process. I have to attend it for Dyan, who can't attend it, just to get through to the next stage so that she could get access to a pain specialist, a pain fellow, to actually work on accessing pain medication that suits her condition. Stupid, isn't it? Well, this is a reality. This is why we share the information on the channel, because a lot of people don't understand the processes that people have to go through, the hoops that they jump. Now, could you imagine Dyan who's like this going into hospital and attending a group, sitting up in plastic chairs in a circle for 5.5 or 6 hours, maybe with a lunch break for a half an hour, like participating in doing that? I can't imagine her doing that. This is why it's being done by teams, so a video consult. That took a lot of effort to actually organise, and I'm having to do the process for her so that she can just lie, relax, sleep, not get herself uncomfortable, and of course go to the toilet probably 30 times in the course of that because she's got a bowel-related issue. Alright, just 2 moments. Which is great to be not just bowel, but also the urinary tract, the frushimon. Because of the edema, up to 3 kilograms of water weight, her body is passing through a lot of fluid every day, and that causes her to go toileting a lot. Sometimes up to about 40 times in a day. She actually goes through 2 to 3 toilet rolls in a day. It's amazing. It's amazing. You're lucky. She's lucky. We're lucky. Your eyes look terrible. I'm just saying that. I love you, but your eyes look terrible.
I burped.
You burped?
It didn't come out.
Good, good. And I do worry about that because if medications come back up, you've got to account for that. You've got to look at, do I need to give another one? When can I give another one? What effect has it had? Is medications absorbing when we're like this? If certain medications that we need to get through to aren't absorbing, are the liquid versions that we should be using? Is there a time when we need to take her to hospital? There are people who will probably say, oh look, take her to hospital now. We can't do that. We can't put her into an ambulance. We can't then go. Ambulances are ramping at the moment in hospital, and they ramp for up. There's 50,000 hours of ramping in WA state hospitals in Perth.
Can't tolerate a tube incubation or peg.
No, you can't. Because your body reacts with a foreign body reaction, exactly. So the last time Dyan was intubated with an NJ tube, which was to help the gastroparesis, because the tube goes down to the duodenum, bypasses the stomach contents, it takes out the whole digestive enzyme part, and you can actually then put a liquid through a food meal replacement drink. Great concept, but her body then started shutting down, organs started to fail. She started to have anaphylaxis response because she's got something in her body which her body didn't like. Cytokine storm on steroids. Not a good fun. We have so many challenges. Nothing is easy. It really isn't. Look at what's going on at the moment. How's your eyes going, honey? Yeah. Good look, that.
I don't know.
Are your eyes open or closed? Can you see me?
Yeah.
Okay. How's your body feeling right now?
Sick.
Just sick. No, blah. Yeah, it's very, very expressive. You've done well. Good. Now this could go on for hours, so we're just going to work through until everything calms down, we get things settled down, and then hopefully I can get some other medications in to help her sleep. They'll be delayed now, so that has a knock-on effect. What's going on? Why do you have cramp in your arm? You okay? Any chest pain?
I know.
Dystonia?
Yeah.
Dystonia, which causes muscle contractions, and obviously Dyan's been going through the dystonia. That's why I'm pointing out the eyes. The eyes are an indication for me normally with the blepharism or a mandible that'll jump into things such as this. This is where the posturing of the hands. See how the fingers? See how the fingers are locked in? Okay, so these fingers, they're curled in and are so tight I can't open them to do so. We'll probably and cause an avulsion or break. Hello, don't fall back. No, no. See this position that she's sitting in right now? And she falls back, we can either dislocate knees or hips. Why are you sitting like that? You're sitting like that for stability. It ain't going to help you if you fall over. Hi. You're not very helpful to me, are you, doing this, Bubba? Are you able to lie down at all? It'll be a lot safer. I'm going to take that. I'm going to take the bluey. I'll swing your leg around. I'm going to do this leg first. Which way are you going? Okay. Okay. Just in case we need that. Let's make sure the oxygen feed is in.
Everything is so
That's
annoying.
okay. Hey Google, turn my lamp off.
The noise and the feeling
I know,
of
but I can't stop the oxygen at the moment because you're not stabilised, sweetie. So unfortunately, we're going to keep that machine going. It's a fairly quiet machine, but it does, if you listen carefully, make that noise consistently. So for Dyan, it's obviously going to be a little bit louder because she's closer to it. I've just turned the lights off just to subdue the room, hopefully help a little bit.
Give me some
Of course I can.
Oh, thank you.
You're welcome.
I feel swollen.
Well, I'm not surprised with lower peripheral edema on top of your full body edema that you've got. You're doing okay. We really do appreciate the people following the channel, subscribing, keeping an eye on Dyan as she goes through all of this. And I do appreciate the fact that it is helping to educate and advocate about Dyan's rare genetic condition, 22q11.2 deletion syndrome. Had a lot of old names in the past. Those names are superseded because of the evolution of genetic medicine should I say, and the discovery that a lot of those old things were Schwitzens, Schwergens, velocardial syndrome, DeGeorge, all of these other names all really met the same criteria of what 22q is. So this is the beauty of science. As it evolves, they can actually start to bundle a lot of older conditions under one umbrella and say, oh well, these older conditions were really this, and it was caused because you had either a duplication or a deletion, you're missing a number of genes, or they're replicated in a way that's causing the body confusion. Science is evolving gently and slowly. Just not fast enough.
I'm so pain.
Okay, I can give you some CBD for the pain. It will help your nausea as well, sweetie. Yep, okay, I've got a nod, so we're doing the CBD. My medicine cabinet is right conveniently placed, everything's stocked like a pharmacist, and it just makes easy access. We have, for the support staff coming in, a medicine checklist so that they know, also medicine identification. Everything is photographed with names so that they can easily identify what medicine is what, quantities,
Still don't get it.
and how to apply it. You coming?
It's just gone legs.
Okay. Good girl. Washing the syringe out, you okay?
No.
Are you doing your ET impression with your watch?
No.
No. Towel is there. Oh, as I massage Dyan's feet into relaxation and hopefully trying to keep her nausea down, whilst also monitoring her condition as she potentially goes into further, whether it's cardiac or respiratory or seizures or dystonia. We just have wishful thinking it'll be something nice and easy tonight, but it's not. She really desperately needs sleep, so wish her some really good restorative, relaxing sleep. My alarm will be up early in the morning. I haven't even had a chance to clean my teeth or have a shower today. I'm still wearing the clothes from yesterday. I haven't had a chance. I literally have not had that chance to leave her side whilst I'm dealing with all this crap. So it is stupid. Dyan, you okay?
Yeah.
Okay. So tomorrow morning we'll be up bright and early, have a shower, do all those things that I've missed out today. That's the carer's lament. That's what we go through. Everybody misses out. Dyan as a patient, she hasn't had a shower today either. She's missed out on the food that she needs to have, and the support whilst having to deal with all these organisations. So frustrating, so damn annoying. But guys, thank you very much for your support. Comments as usual. Give Dyan a big thumbs up of encouragement, because your support really does matter. It does actually help, and we do see it. Even when Dyan can't read, sometimes when she's struggling cognitively or her eyesight's poor, I read out the comments to her and say who it's from. So a big hello and a big shout out to everybody who's been following recently. So comments, questions, ideas and suggestions, leave them below. If you're new to the channel, welcome. Don't forget to subscribe and hit the notification bell. I'm hoping that nothing more is going to happen and that the nausea will settle down. But this is an insight into what we deal with each and every day.